stroke rarely feels like a warning at first. That is what makes it so dangerous. It may not begin with someone collapsing to the floor. It may not begin with a dramatic scream, a fall, or a rush to the hospital. Sometimes it begins with one hand feeling strange while you are holding a cup. One side of the face feeling heavy for a few minutes. Words suddenly not coming out right. Vision fading in one eye and then coming back. A strange loss of balance that disappears before you can explain it. And because the symptom goes away, most people relax. That is the mistake. I am Dr. George White, and today I want to talk to you about what a stroke can look like before the major stroke arrives. Because many people believe a stroke comes out of nowhere. One moment you are fine, the next moment your life has changed. But in many cases, the brain gives warning signals first. Small signals, short signals, signals that may last only minutes. And those few minutes may be the most important warning your body ever gives you. A stroke is one of the most serious medical emergencies in the world. It can take away speech. It can take away movement. It can take away memory, balance, independence, and the simple ability to walk across a room without help. For older adults, this is not just about survival. It is about whether you can keep living in your own home, keep recognizing your family, keep holding your grandchildren, keep driving, keep cooking, and keep being yourself. That is why this video matters. Because the most dangerous stroke warning is not always the one that stays. Sometimes the most dangerous warning is the one that disappears. Before I explain the signs, you need to understand what is happening inside the brain. Most strokes happen when blood flow to part of the brain is blocked. The brain needs oxygen every second. It does not store much backup fuel. When a clot blocks a blood vessel, the brain cells beyond that blockage begin to suffer very quickly. If blood flow is not restored, those cells can die and the damage can become permanent. But before a major stroke, some people experience what doctors call a transient ischemic attack. Many people know it as a mini-stroke, but I do not like that phrase because it makes it sound small. It is not small. A transient ischemic attack, or TIA, happens when blood flow to part of the brain is blocked for a short time and then opens again. The symptoms may last a few minutes. They may last less than an hour. Then the person feels normal again. The face looks normal again. The arm works again. The words return. The vision clears. The person stands up and says, "I am fine now." But they may not be fine. That short episode can be a warning that the blood vessels are unstable. It can mean there is a clot risk, a narrowed artery, an irregular heartbeat, uncontrolled blood pressure, or another problem that could soon cause a full stroke. The fact that the symptom disappeared does not mean the danger disappeared. It may mean the first alarm has already sounded. This is where many families lose precious time. A person has numbness in one arm for 10 minutes, then it goes away. They decide to sleep and see how they feel in the morning. Someone suddenly cannot speak clearly, then recovers. The family says maybe it was stress. Someone loses vision in one eye, then it returns. They blame tiredness. Someone feels suddenly off balance, then sits down and feels better. They blame age. But a TIA is not something to watch at home. It needs same-day emergency medical evaluation. Not next week. Not at the next routine appointment. Not after seeing if it happens again. The first warning may be the only warning before the major event. The first sign to know is sudden weakness or numbness on one side of the body. This is one of the classic warning signs. It may affect the face, arm, leg, hand, or the entire side. The key word is sudden. This is not the slow stiffness of arthritis. It is not the familiar aching you feel after gardening or walking too much. It comes quickly, often in seconds. A person may notice that one side of the face feels strange. The mouth may droop slightly. A smile may look uneven. One arm may feel heavy, almost like it does not belong to them. They may try to lift both arms, but one arm drifts down. A hand may suddenly become clumsy. They may drop a spoon, a phone, a toothbrush, or a cup. One leg may drag while walking, or the person may feel as if the floor has changed under one foot. The body is giving a very clear message. One side of the brain may not be getting proper blood flow. This one-sided pattern is important because the brain controls the opposite side of the body. When blood flow is interrupted in one area, the weakness often shows up on one side. If this happens, even if it lasts only a few minutes, call emergency services immediately. Do not wait for it to come back. Do not test it repeatedly at home. Do not say, "It passed, so it must be nothing." A symptom that disappears can still be a stroke warning. The second sign is sudden trouble speaking or understanding speech. This can be frightening because the person may look awake and aware, but their words do not work properly. They may know what they want to say, but the words will not come out. They may speak in a way that sounds confused, slurred, broken, or mixed up. They may use the wrong words. They may stare at you because they cannot understand what you are asking. Sometimes the person realizes what is happening and becomes scared. Sometimes they do not understand why everyone around them looks worried. A husband may ask his wife a simple question, and she answers with words that make no sense. A father may try to say he is fine, but the sentence comes out twisted. A grandmother may suddenly stop mid-sentence, unable to find even a common word. This is not normal forgetfulness. This is not the usual pause when a word is on the tip of your tongue. Sudden speech trouble is one of the strongest warning signs of a stroke or TIA. It can mean the part of the brain that controls language is not receiving enough blood. And again, if it clears up, that does not make it safe. In fact, that is exactly how many TIAs behave. They appear, they frighten everyone, they disappear, and then people make the wrong decision because relief takes over. But relief can be dangerous when it makes you delay care. The third sign is sudden vision change. This may happen in one eye or both eyes. A person may suddenly see blurred vision. A dark area may cover part of their sight. They may feel like a curtain has been pulled over one eye. They may see double. They may lose vision briefly and then have it return. This kind of symptom is easy to dismiss because vision problems are common as people age. Many older adults already deal with glasses, cataracts, dry eyes, or night driving problems. But sudden vision loss is different. If your sight changes suddenly, especially in one eye, it can be a sign that blood flow to the eye or the vision areas of the brain has been interrupted. Some people describe it as someone dimming the lights on one side. Others say it looked like gray fog. Others say one eye went black for a short time and then came back. They may feel embarrassed to mention it because it sounds strange. But this is exactly the kind of warning that needs urgent attention. The eye is not separate from the brain. The blood vessels that feed the eye are connected to the same circulation system that can be involved in stroke. A temporary loss of vision can be a warning that the artery system is in trouble. If this happens, do not drive yourself around. Do not wait for an eye appointment days later. Get emergency help. The fourth sign is a sudden, severe headache with no clear cause. This matters especially for bleeding strokes, where a blood vessel bursts inside or around the brain. Not every headache is a stroke. Most headaches are not strokes. Many people have tension headaches, sinus headaches, dehydration headaches, or migraines. But the headache we worry about is different. It comes suddenly. It reaches full strength very fast. It may feel like the worst headache of a person's life. It may be unlike anything they have ever felt before. It may come with vomiting, neck stiffness, confusion, weakness, fainting, vision changes, or trouble speaking. Some people describe this type of headache as a thunderclap. It does not slowly build over hours. It strikes hard and fast. If someone suddenly develops an explosive headache that feels completely unusual for them, treat it as an emergency. Do not lie down and hope it passes. Do not take pain tablets and wait. Sudden severe headache can be a sign of bleeding in or around the brain, and time matters. The fifth sign is sudden loss of balance or coordination. This is one that seniors often misread. Many older adults already have some dizziness, blood pressure changes, foot numbness, weak legs, inner ear problems, or medication side effects. So when they suddenly stumble or veer to one side, they may explain it away. But stroke-related balance trouble is often sudden and unusual. A person may feel as if the room shifted. They may walk like they are being pulled to one side. They may reach for a wall even though they were fine moments earlier. They may be unable to coordinate their steps. They may feel clumsy, unsteady, or strangely disconnected from their body. The back part of the brain and the brain stem help control balance, coordination, eye movement, swallowing, and walking. A stroke in this area can be especially dangerous because symptoms may be less obvious than facial drooping or arm weakness. People may call it dizziness, but it can be more serious than that. The warning becomes even stronger if balance problems happen together with double vision, slurred speech, weakness, numbness, trouble swallowing, or a severe headache. Any sudden change in balance with no clear reason needs urgent medical attention. Now let me give you the simple stroke test everyone should know. It is called FAST. Face. Ask the person to smile. Is one side drooping? Arms. Ask them to raise both arms. Does one arm drift down? Speech. Ask them to repeat a simple sentence. Is the speech slurred, strange, or confused? Time. If you see any of these signs, call emergency services immediately. But I want you to remember something beyond FAST. If the symptom appears and then disappears, you still act. If the face droops for 5 minutes and then returns to normal, you still act. If the arm goes weak and then feels fine, you still act. If speech becomes strange and then clears, you still act. If vision goes dark and then comes back, you still act. The return to normal is not proof that the brain is safe. It may be proof that you just had a warning. This is why the hours after a TIA matter so much. Doctors may need to check the brain with imaging. They may need to look at the blood vessels in the neck and head. They may need to check the heart rhythm because an irregular heartbeat can send clots to the brain. They may need blood tests, blood pressure treatment, cholesterol treatment, blood thinning medicine, or other urgent steps depending on the cause. A TIA gives doctors a chance to prevent a bigger stroke, but that chance is strongest when you act quickly. Waiting can close that window. Every hour matters because the next clot may not dissolve. The next blockage may not clear. The next symptom may not go away. High blood pressure is one of the biggest stroke risks. It silently damages the inside of blood vessels for years. The vessels become stiff, narrow, and weaker. Small injuries build up. Plaque can form. The heart has to push harder. The brain's blood supply becomes more vulnerable. Many people with high blood pressure feel completely normal, so they do not take it seriously. But high blood pressure can be damaging the brain long before symptoms appear. This is why checking your blood pressure at home can be so helpful, especially after 50. Not once and then forgetting about it, but regularly. Know your numbers. Write them down. Share them with your doctor. Take medication exactly as prescribed if you have been given it. Do not stop tablets because you feel fine. Blood pressure medicine is often protecting you from something you cannot feel. Diabetes is another major risk. High blood sugar can damage blood vessels and nerves. Over time, it can make the blood vessels that feed the brain more fragile and more likely to narrow. Smoking raises stroke risk by damaging blood vessels and making blood more likely to clot. High cholesterol can contribute to plaque buildup in arteries. Lack of movement, obesity, heavy alcohol use, poor sleep, and untreated heart rhythm problems can also increase risk. Stroke prevention is not one magic trick. It is a pattern of protection. Control blood pressure. Manage blood sugar. Treat cholesterol. Stop smoking. Move your body. Sleep well. Take prescribed medicines. Keep follow-up appointments. And never ignore sudden neurological symptoms. Let me make this more real. Imagine a man in his late 60s. He is sitting at breakfast and suddenly his right hand feels weak. He drops his fork. His wife asks if he is okay. He says, "My hand just felt funny." A few minutes later, it seems normal again. He laughs it off and says, maybe he slept on it wrong. They finish breakfast. He goes about his day. That night, he watches television, feels tired, and goes to bed. The next morning, he cannot move one side of his body. This is the story doctors hear too often. Not always exactly like this, but close enough. A warning came. It passed. Everyone relaxed. Then the larger stroke arrived. Now imagine the same man, but this time his wife knows what that warning means. She calls emergency services, even though he says he feels fine. At the hospital, doctors find a narrowed artery and start treatment. The major stroke may be prevented. His life may continue almost unchanged because someone took the short warning seriously. That is the difference knowledge can make. And it is not only for you. It may be for your spouse, your parent, your neighbor, your friend from church, someone at the grocery store, someone sitting beside you at dinner. Stroke warning signs are not always recognized by the person having them. Sometimes the brain problem itself makes the person confused, embarrassed, or unable to speak clearly. That is why family members must know the signs too. If someone suddenly becomes different, do not argue with them. Do not let them talk you out of calling for help. A person having a stroke warning may insist they are fine because they are scared, confused, or the symptom has already passed. Your job is not to win an argument. Your job is to protect their brain. One of the most painful things families say after a stroke is, "We saw something, but we did not know it mattered." They remember the strange speech, the dropped cup, the stumble, the dark vision, the numb hand. They remember the moment, and they wish they had acted sooner. I do not want that for you. So let us repeat the most important rule in plain words. Sudden weakness, sudden numbness, sudden speech trouble, sudden vision loss, sudden severe headache, or sudden loss of balance should be treated as an emergency, even if it goes away. Do not sleep it off. Do not wait for morning. Do not drive yourself. Do not call a friend first. Do not search symptoms online while the clock is running. Call emergency services. When it comes to stroke, time is brain. Every minute of blocked blood flow can mean more brain cells injured. Fast treatment can make the difference between walking out of the hospital and needing long-term care. It can make the difference between speaking clearly and struggling for words. It can make the difference between living independently and needing help with basic daily tasks. And please understand this. Calling for help and finding out it was not a stroke is not a failure. That is a good outcome. Doctors would rather evaluate you quickly and find a less dangerous cause than see you arrive too late after a preventable stroke. Do not be embarrassed. Do not worry about bothering anyone. Stroke symptoms deserve urgent care. Now I want you to think about your own risk. Do you know your blood pressure? Do you know your cholesterol? Do you have diabetes or prediabetes? Do you smoke? Do you have an irregular heartbeat? Do you snore heavily or stop breathing during sleep? Do you move less than you used to? Have you had brief numbness, weakness, speech trouble, or vision changes before and ignored them? This is not about fear. It is about honesty. Fear without action is exhausting, but fear with the right information can save a life. If you are over 50, make stroke prevention part of your normal life. Keep a blood pressure monitor at home if your doctor recommends it. Walk regularly if you are able. Eat in a way that supports your heart and blood vessels. Take your medicines seriously. Keep your appointments. Ask your doctor whether your heart rhythm needs checking if you have palpitations, dizziness, or unexplained weakness. And teach your family the FAST test. Also, keep a written list of your medicines, allergies, health conditions, and emergency contacts somewhere easy to find. In a stroke emergency, confusion is common, and family members may not remember everything. A simple paper list can help doctors act faster. This is a small step, but small steps matter when minutes count. Tell the people in your home this rule. If my face droops, if my arm gets weak, if my speech changes, if my vision suddenly goes, if I get the worst headache of my life, or if I suddenly cannot walk straight, call emergency services. Do not ask me to decide in that moment. Decide now while your brain is clear. That conversation may feel uncomfortable, but it is an act of love. Families talk about bank accounts, house repairs, weddings, holidays, and bills. They also need to talk about what to do if a stroke warning appears. The plan should be simple. Recognize the sign. Note the time it started. Call emergency services. Do not give food or drink if the person is confused or having trouble swallowing. Do not delay. The time the symptom started is important because some stroke treatments depend on timing. If you do not know exactly when it started, tell the medical team the last time the person was known to be normal. That one detail can affect treatment decisions. Stroke does not always give a second warning, but when it does, the warning may be short, quiet, and easy to excuse. A numb hand, a crooked smile, a sentence that makes no sense, a curtain over one eye, a sudden stumble, a headache like lightning. These are not moments to explain away. These are moments to act. Before you leave, I want you to remember the line that may protect your life or someone else's life. If it comes suddenly, think stroke. If it affects one side, think stroke. If speech changes, think stroke. If vision disappears, think stroke. If it goes away, still think stroke. The brain does not always shout before disaster. Sometimes it whispers for a few minutes. Now you know how to listen. If this information helped you, subscribe and share this video with someone you care about, especially someone over 50 or anyone with high blood pressure, diabetes, heart disease, smoking history, or previous stroke symptoms. The person who needs this most may be the person who would normally ignore a warning and go to bed. This video is for education only and does not replace medical advice from your own doctor. If you or someone near you experiences any sudden stroke symptom, call emergency services immediately. Time is brain, and acting fast can protect the life you worked so hard to build.